Garth Griffin, co-founder, CTO of Gigasheet, and my background is in computer science, programming, sort of the tech side of everything. So I studied that in school. I was at Google, that's worked for Harvard. Previously ran a data science team at a cybersecurity company, and now here. So I all things tech. That's my side of the story.
Yep. Thanks for that. Yeah, likewise. I also started as a software engineer and then got into in national security, data analytics. I worked at Google for a while as well, and in cybersecurity, and obviously now with a lot of healthcare data, particularly. But sort of the common thread behind all of this is, working to find signal within the noise and working with large amounts of data that's imperfect to find valuable bits of intelligence. And I think that's what we're going to dive into and talk about today, especially around price transparency data. Um, and we're going to have hopefully a little fun too. We're going to try a few things, so we'll see how it goes. We're not afraid to try. We'll be doing some live demos. We'll be taking a look at real data here, and yeah, we're not afraid to put it out there and do that. So why now? Why price transparency data? Why focus on this? You know, the volume of data that's out there is pretty unprecedented, especially in this market. You could try to approximate this with the identified claims data, but obviously that data has its own challenges. It can be difficult to wrangle. Obviously, you have sensitive information in there. It can be dated, and depending on who's aggregating the data, it can be sparse in certain areas. So it's sort of imperfect. Price transparency data, we started Gigasheet in 2021, really, and shortly after the transparency and coverage rules went into effect, we saw people loading the data into our platform themselves with limited success, and we really didn't have a lot of success helping them because frankly, the data just wasn't very good. And I don't mean that in terms of the fidelity of the data. What I mean is the files themselves were malformed, the machine readable files that payers and hospitals are required to publish under the rule. But about 18 months ago or so, the data became workable. And ever since then, we've really started adding more features and functions to our platform and pipelines to process this data and make it easier for people to work with. Um, and it's interesting, obviously, healthcare costs in the market. I don't think anyone who's joining this is shocked to hear that it's expensive and it is outpacing inflation, especially for employers. It's been interesting to see that even, modest size employers are now self-funding themselves in an effort to save money. The transparency data, hopefully, is helping to drive competition. I think we're just still scratching the surface. There's so many uses for this information. Obviously, for self-funded plans and their partners, whether that's consultants, benefits, partners, brokers, for example, using this data. But there's a whole host of other people as well, everyone from hospitals to provider groups and even medical device manufacturers and life science companies leveraging this data just to get more insight into what has traditionally been a very opaque market. Um, so the opportunity here and what we're going to talk about today is sort of from that self-insured, self-funded employer perspective, or someone who's working with them and supporting them, whether that's a TPA or broker or consultant. And there are a bunch of insights you can gain from this depending on your perspective, but we're going to take that the self-insured perspective in this webinar and take a look at it from that angle through that lens. So we're going to look at how you might use price transparency data to identify cost-effective plans, how you can use it to spot unusual claims or potentially fraudulent claims. Um, and then even how you might use it to guide steerage and network design. If you're looking to pick an ASO or a partner, how you could use this information to help with that. So with that, we're going to dive into it. I'm going to let Garth tee up our example scenario here that we're going to go through in this session. We will take questions. Feel free to drop your questions into the Q&A panel, and we'll get to those. Always happy to tackle some questions. Usually we do that at the end, but feel free to drop them in anytime, and we'll take a look at it. So, Garth, I'll let you sort of set the stage for this scenario, and then I'll help dive into some of the data.
Yeah, so let's talk about this, the kind of the story here. Jason's going to show the actual analysis process in a few minutes here, but I'll kind of set up the story. So we'll be looking at a fictional company, Skynet. Some of you may be familiar. And the company's made up, but we're going to use real data. So Jason's going to do analysis on real data, but we'll sort of do it from the lens of this fictional company, Skynet. And in our story today, this is a hip young agritech. So they're an agritech company in Boise, Idaho. It's like a tech company, and so their workforce is 450 or so employees, and they're 25 to 35 years old. So if you think about that from the perspective of kind of the healthcare side, what that means is the kind of the things that you're going to expect to need to spend money on healthcare wise for that cohort of folks, probably a lot of maternity and pediatric care. Um, there might be probably other things they're going to do regular doctor visits and so on, but those are kind of a couple of expensive areas for healthcare needs for this group. If you were, depending on the data you had internal to the company, you could even do the more sort of in-depth version of that where you take like claims data or things like that, and you really match up, exactly what my demographics are and so on. So there's, you could do an even more data-driven or data-oriented version of that. But today we're doing kind of a little bit the simpler version. And we're just going to say, look, we know those are going to be some expensive areas of the health services that our workforce are covered. Folks are going to want to, avail themselves of. So we're going to focus on those. So that's kind of our input. And the other input is they're in the Boise area. It's not a remote company. It's in the office. Skynet is an in the office sort of affair. So um, we're going to be they're going to expect that these folks are going to go to providers sort of in the greater Boise area. So that's kind of the setting for the story. And the person doing the analysis, there's a lot of participants in this kind of thing where, it could be you doing it in-house, especially if you're a larger company, they might do it in-house. Or, maybe it's like a consultant that's helping, or you might be brokers sometimes do this. There's a lot of participants in this ecosystem. But you could kind of imagine that, we're going to be going through an analysis that a consultant would do to help out Skynet as they make their selection. Um, and the challenge really for them is they're trying to find the high quality care. It's got to be high quality. We know it's got to be in Boise. Um, we want to make sure we have a good variety of providers. So, got to make sure that people might have their doctors that prefer this doctor or that doctor. And, with those constraints, we also want to try to, not overspend. So that's the kind of our challenge here as Skynet or as the consultant helping Skynet or whoever, we know we're going to have a lot of these pediatric maternity claims. We need nearby providers. And the risk or opportunity, depending which way you want to think of it, is that the rates for the providers, the contracted rates for these providers vary widely across different payers. And so when we're trying to make a selection about who we should use to offer this benefit program to our employees, which network we choose, which payers we're working with, those things matter a lot. So the risk or the opportunity is we want to make sure we make a really good choice about where we go to offer this benefit. What network are we going to use? Because that's going to impact our cost a lot. So to solve that challenge,
And
the approach.
hypothetically, you might just stay the same, right? So you might compare the plan that you have, the options that you have, and what you're paying today, and say, it's actually reasonable or do nothing, right? Like continue with what you've got. And a lot of times when companies look at this, typically they're up for benefits review, but they might be just benchmarking and looking at kind of their current options within the market or looking for, like you said, kind of low cost, high quality providers they can steer to within their current plan. So yeah, sorry, go ahead.
Exactly, that's right. And depending on there's a lot of factors that kind of weigh into the final dollars here, but depending on how big your company is, how big the company is, the the type of work that gets done or the workforce that you have, and just what the sort of healthcare market is like in your region, it can be pretty significant amount of money. And so, spending a little time with some data to really try to optimize this. Can be a really great ROI, really great return on investment for the time you'd spend. So the solution we're going to use is benchmarking. And really, there's again different kind of data sets that you could try to bring to bear on this problem. Um, but what we're after is some kind of sense, some kind of, data measurement, a quantitative measurement of how much is the expenditure going to be, when a employee at this company goes and receives healthcare services, what is going to be the amount of money that has to go to the provider? And so we've got a few key in Boise here, this scenario, Skynet in Boise. We've got a few payers that are really the ones that matter the most. So that's Blue Cross of Idaho, which Blue Cross has sometimes different subsidiaries and so on, but Blue Cross of Idaho, Regents, and Cigna, especially the first two, and we'll see, how that shakes out in the data. But those are kind of the key ones. There obviously are other insurance companies, but we can kind of already say most likely we're going to go with one of like the big ones in our geography. They kind of tend to focus, the insurance companies tend to be more or less prominent in different parts of the country. So those are kind of our main ones. Um, we're going to be looking for cost differences or contracted rate differences in maternity and pediatric care because that's going to translate directly to cost savings or higher or lower expenditures for the company, for Skynet, the company as a self-funded employer. And the data we're going to use is Gigasheet's price transparency solution. So this is using public price transparency MRF files. So these machine readable files that the payers and hospitals, but especially payers, are publishing. And the great thing about this is the data is out there. So it's public. It's legally required to be published. And so the data is available. What Gigasheet really brings to assist with this is that the files can be very, very difficult to work with in a large variety of different ways. So they're huge. So there's like technical challenges. The data can be very big. But even if you're able to get the data and you get the data nicely in hand, there's all kinds of strange things that you find in there, things that are not relevant, things that don't make sense. So at Gigasheet, we kind of use our background in data analysis to bring that data to a more sensible kind of representation of what's really going on, what you really can expect. And these kind of, processed outputs working with that public data is really a lot more impactful and is going to really sort of get you to a better decision. So that's kind of our approach. We're going to use these benchmarks that we're going to derive from Gigasheet's solution based on the public contracted rates that are published by insurance companies. And that's going to help us, at Skynet or, advising Skynet, it's going to help them get a more optimal choice for this benefit that they're going to offer their employees and save them some money. So that's our story for today. I'll turn it back over to Jason.
Yeah, like Gar said, in reality, probably could model out claims using claims data from Skynet to do this. Uh, but for today's demonstration, we'll start with just looking at some benchmarks, like Garth mentioned here, and let's dive into some data here. So this is in Gigasheet. This is what the raw data looks like. We're looking at 206 million rows. Each one of these rows is a rate for a specific billing code and provider in Idaho and for a different payer and plan. You can see we have lots of details there. We actually enrich this information a lot with Medicare benchmarks, with NPI data, taxonomy codes, and additional information to make it more usable. It's one thing to just get the data, it's another to get insights and intelligence out of it. So first we'll start with this is a subset of that data that we pulled just for the for Idaho overall, and we're focused on um, pediatrics, like Garth mentioned. This is sort of a young population and childbirth. So you can see we've got two categories here. The way the data is organized in this sort of hierarchy here, We've got a couple thousand rates under childbirth for a handful of MSDRG codes. We've got a CPT code here for ultrasound. And then we've got some common pediatrics codes as well, office visits and a strep test. And we can already start to see within the data here, what the average negotiated rates are when you roll it up. But if we expand these groups, we can then see the rates broken down for each payer. And if we expand the payer, we can then see the individual rate codes, the variance here. We can see sometimes there's a per diem rate, a negotiated rate, or fee schedule rate. Then we can see the providers here who are offering this service in this case and their complete details and even their corporate entity that they're associated with. So at a very high level, we're just looking across the state to get an idea what the rates are here for these various procedures. And we could, of course, browse through this ad hoc and take a look at, what is a typical office visit going to look like in terms of cost. And we can already start to see there's some variance here where Cigna is looking a good bit cheaper than, say, Regence or Blue Cross Blue Shield at a high level. But if we go back to our uh, if we go back to our slides here, another thing we talked about is spotting outliers. So being able to look at extreme costs within this data and highlight anomalies. But let's go back to this quickly and let's flip to a different view that I have and let's dive into childbirth. Obviously can be very expensive, but let's look at it from a high level to start and then we'll drill down. So basically, this view, which I've configured, is the same data, but we've added an additional filter here to just look at zip codes in the greater Boise area. And when we look at 768, which is kind of a standard delivery code, DRG code, we can see like it's pretty insane actually what the Cigna rates are in this data. So what initially looked like might be a good deal, and you'll see, I've looked at this data before, Cigna actually looks like a pretty good deal in a lot of ways, except in this way. So if you know you're going to have people having babies, you should probably consider that when you look at Cigna, if you're considering them for your self-funded plan. So we can see there's definitely some overlap in the providers here, but the rates vary widely. And that is kind of astonishing, frankly, that you could go to the same hospital, have the exact same procedure, and the difference vary like $10,000. So um, we can also look at other procedure codes, of course, like a C-section as well. And we can see here what the Blue Cross rates are with each of these providers. Not too surprising, this one stands out as an outlier. This is a VA medical center, so it is cheaper. But then you can see actually Treasure Valley comes in with very competitive rates, and these are a bit more expensive here. So that's just kind of a quick look at childbirth, sort of benchmarking that. We can do the similar exercise for pediatrics. So I'll flip over and look at billing codes associated with pediatrics. We'll filter to taxonomy codes that are pediatric providers. And we'll just look at office visits, standard office visits here. And you can also see variation in the rates data as well. Now I'm looking at median here because there can be a lot of different rates. Like, when you're looking across 541 different rates in this case, you kind of want to get an idea, but you can always drill down to the row level details within Gigasheet and look at this. And we can see here there is quite a bit of variance among providers in this case. So we might want to flip to say what the max, min, or even just the average is on these cases. And it's easy to recalculate these on the fly so that we can compare it to Medicare rates as well. And then again, it's easy to see exactly who's getting this. So perhaps not surprising that it's more expensive to go to a pediatric cardiologist as it is to just a standard pediatrician. And you may want to filter or group that accordingly. So it's easy to then, while I created this pre-configured view, and we routinely help customers create these, um, you might want to on the fly kind of tweak it for a specific drill down to just look at pediatricians in this case and get a look at those rates there. So um, that's that's kind of a high level look. We also, oh yeah, right. Back to the spotting outlier claims. We have this example, one example that might occur, which is, let's say you just have this data. Maybe you're not reviewing benefits. You're just looking at a claim that comes in that's very expensive, and you see a rate for a childbirth, 775 DRG code for 23K, but it's for like an in-home provider. So people have babies at this company. That's not crazy. So we have some other claims. So we kind of have an idea. And maybe it should be more expensive because it's in-home, but we're not sure. It's easy to go in this same file that we were looking at in the same data set and just sort of reorganize and look at it through that lens. So here what we've done is a simple filter where we filter to the billing code 775, and then we said we want to look at, maybe a handful of different providers. So typical hospital rate versus home health agency. And here we can actually see, in this case, it's actually a little more expensive, certainly than a hospital, typical hospital rate. And we can see how much data we have. We have 70 rates for in-hospital. Kind of makes sense. And for in-home, it's fewer, which isn't necessarily surprising. But if we expand this, we can see, yeah, it's pretty tight. There's no variance here, but it's not $23,000 for in this particular case. So that might be something to look into more carefully on what's going on in that case when it comes to spotting outliers. Um, we're going to go back to a regular scheduled program, but I'm going to take a break here while I do this next piece. I'm going to share with you something that we've been working on that's kind of interesting and we think exciting, and that is how you might benchmark this and actually use AI to do that. And this is Claude. If you're not familiar with Claude, it's similar to something like ChatGPT. And I've basically given it access to Gigasheet. So at Gigasheet, we have our own AI price transparency agent. It's an analyst. And I've given it sort of some background information. And I'm going to give it the URL to that data we were just looking at and say, I want it to drill into office visits and prepare a report for me that's more detailed on that. So I'm going to kick this off. It's going to analyze the data. Hopefully, we'll see how it goes. We'll come back to it at the end of the webinar and see what it's done. But anytime you see this G here, it means it's using Gigasheet. So it's actually in the product looking at the data, and now it's going to analyze it. So I'd like it to do a more in-depth analysis of those office visits, 99214, and we'll see what it comes back with later in the session. But for now, let's go back to the slides and we'll check on this in a little bit. So we just talked about spotting outliers and how you can use the data for that. But let's talk a little bit about steerage. You probably can imagine how it would work here, like adjusting plan design with a narrow network, negotiating contracts with TPAs or payers, and then steering employees to high value facilities. Like we talked to one employer, different example with dialysis also can be very expensive. It was actually $1,300 more expensive to go to this one place. They had a patient going for dialysis. There was another place 3 miles away across town that was much cheaper, and they ended up giving them Uber vouchers to go to the other facility because they're literally saving hundreds of dollars every dialysis session. So You absolutely can use this data to identify those kinds of opportunities, or maybe even opportunities to do direct contracting with, say, a primary care group, or maybe even a pediatrics group in this case. So in this example, going back to that same data set, we're going to look at a particular view here of, as the data pulls up, of 99214. These are those office rates. Actually, we'll see if how the AI analysis compares and how it does. But we can see here for these office visit rates in the Boise area that we can see by provider, what their median rates are and how they compare to Medicare. Now, it's not surprising that Medicare, is very consistent. It should be. Boise, there's not going to be any variance based on the geography for Medicare there. But we can definitely see some people are getting, 219% as a median versus 193% or even 314% of Medicare. And of course, like in the other examples, we can expand this and drill into these here. And you could see like this is an infectious disease physician versus something like these community health clinics that looks uh, like this. And if we scroll over, we can see all the details, even the location. So we could make a decision based on that. So that's an example of how you could quickly take a look at this and just see the range that's within this data set. And what's even within this, Boise isn't the largest market in the world, but even within this, there's quite a bit of discrepancy between rates across payers and providers and their various contracts. So super important for self-funded plans to take this into account when they're reviewing their benefits or even just becoming more efficient with the plan that they have today. So we'll flip back over to the slides here. So some takeaways, work with partners. If you're in the self-funded ecosystem, you want to work with partners look across payers before renewing benefits and just make sure that you're getting best rates. We can even pull employer plans into GigaSheet directly and parse the data similarly to a table like I showed you here before. And it's common to see, for example, that they won't have as many provider negotiated rates in those files. So, if you know that's something of interest, it's something you could push on when it comes time to review your benefits. Obviously, monitoring claims and being able to pop into just a simple spreadsheet interface, type in a billing code, and see is this, just spot check, is this expected? Is certainly a powerful use case. And then, of course, steering people to high value care, creating incentives, or even designing plans that better meet your needs. So that's a quick summary of some of the ways people are using price transparency data, particularly in the self-funded ecosystem, self-insured ecosystem. So how to get started with this stuff? Well, as I mentioned, we're big on intelligence and intelligence analysis, and we take a page out of the playbook from actually defense and national security. They came up with this thing called the intelligence cycle, and it's very logical and actually can apply to anything where you're trying to gather intelligence. And it's basically first you want to start with a plan and define your requirements. Review your claims, see where your high cost claims are and high utilization codes, where might not necessarily be the most expensive thing, but if you're doing, hundreds of office visits at the pediatrician a year or even thousands, that can really add up. Um, Collect the appropriate data. We process data for every payer nationwide, but for most people, that's not needed. For some employers, that is needed. For example, you have a huge footprint with employees all over the country. That makes a lot of sense. But most employers are focused or located on one or more markets in one or more markets. So it's not always as concentrated as just Boise, Idaho, but it might be in several states or markets, for example. So you want to get the appropriate data for those markets. And as you probably know, different payers are more dominant or have better networks in different markets. So you want to take that into consideration as well. And then, of course, when it comes to the process, focus on those things that are driving costs. They could be high volumes of claims. They could be just expensive claims, but that maybe you expect to have more of, and then expand from there. And then bring data to the table when it's time to negotiate or review your benefits. So that's kind of a quick overview. Happy to take some Q&A as well. And Garth, I'll probably lean on you to help me with that.
Yeah,
And
of
then
course.
maybe it looks like the that Claude is now producing the final deliverable, so we'll check in on that as well. But yeah, let me open the chat panel. So here's one for you, Garth, and that is, does GigSheet have an API?
We do, yeah. So anything that you can do in our user interface, you can also do programmatically via our API. Our interface uses the exact same API calls as our published and documented on our public API documentation. You'll need an API key, and there's some rate limits and things like that sort of keep our system safe. But yeah, in general, it's very, very full featured. So any sort of analysis activities that if you do it once in the user interface, then you want to run it every hour or run it once a week or whatever. You can automate that with the API. We can help you automate that with the API. So definitely very full featured API available.
So follow-up question on this, could you build an app on top of it?
Yeah, sure, you could. So, maybe you have your own interface. You want to build your own user interface. Think of it that way, like on the phone, or you have some maybe internal something that you have at your company, some internal thing, whatever. If you want to build your own sort of face for it, you could just plug that right into our API and, have us host the data, do the sort of heavy calculations and so on in our high performance data backend. So yeah, absolutely, you could run an app off it.
Cool. Um, Got one more here. How do I export or can I export the data? Yeah, all the data that we showed, whether it was the 206 million rows or the smaller subset of data, can easily be exported. You just go to File, Export, and you can download the data as CSV. Typically, people will export data from Gigasheet to Excel or BI tools. We actually have direct connections for integrations with things like Tableau or Power BI. But usually people often use Gigasheet to explore for kind of like what I was showing you with benchmarking, and then also triage, because these files can be huge and just so much volume. You want to kind of pare it down and then you can work with it in whatever tool you want. But Gigasheet's a great platform for, you know, being able to zoom all the way out and then all the way in.
Yeah,
Um,
I'll just add on. Actually a pretty common flow that we see is there'll be some big data set. And in this case, in this webinar, we were talking about data that Gigasheet sort of prepares and provides. We've done this work to make all that data that Jason was showing to answer those kind of questions to do that benchmarking work. So we're providing the data. You could also have your own data, or sometimes we see people combining data where you're going to bring in a data set that you have or from another vendor or something and combine it with data that we provided, like the rate data, whatever it is. But, a common flow that we see is people will have a big data set or a couple of big data sets, a collection of data, and they have that in Gigasheet because, we can store very high volumes, so no problem for us, right? But if you're a real, Excel power user, you love your tools, your existing tools, we'll see folks pretty often that they leave their big stuff in Gigasheet, and then when they need to do something, they'll grab a little slice. It's very easy to filter or do the groups, sort of get a grouped roll up or a filtered little subset and dump that out and work with it in Excel. So they kind of have us as like the repository, but when they want to do some complicated thing with familiar tools, they'll dump it out. And we have no problem with that, whatever. We just want you to get value out of your data. So whatever works to do that.
Right. Right. Here's another question. And I'll try to paraphrase it, but it's about calculating the total cost, like the provider rate multiplied by the volume of services per patient or condition. Are there data sets that can integrate utilization measures? Yes, I'll take that one. So absolutely, like if we're actually modeling this, we sort of did a very high level aggregate view here for demonstration purposes, but you know, if we were for more in-depth projects, we absolutely would take, like Garth was saying, take data into Gigasheet and integrate it and join it with or cross-reference it with the price transparency data. For example, we would take, a spreadsheet of claims data or other information and use it to build out and model that based on the volume. Like if this fictional company Skynet gave us their actual claims and bills and things like that, we could help with that. There are data sets, like let's say for a different use case where maybe you don't have claims data. If you're a self-insured employer, you should be able to get that data, or your TPA may have it. But let's say you're a different stakeholder in this ecosystem. We actually do have some utilization data based on the taxonomy code. So we have done a statistical analysis of de-identified claims and can approximate, a typical, say, orthopedist, what percent of their revenue comes from a particular billing code, for example. And how many of those on an average year. Now, that works again at the average level. If this orthopedist only does elbows, of course, that's not going to necessarily play out, but it does help. I think possibly the point this person who's asking the question was getting at is, can we integrate utilization measures? Yes. Can you bring your own? Yes. Do we have some? Yes. So there's a lot of different ways to integrate that data. Um, Let me see. The next question was about uh, hospital and hospital adjacent rates won't show a clear picture of costs due to facility fees. So, yes, that is correct. I think I'm not sure if I understand all of it, but I don't think you can draw. I think you have to be careful about looking at an individual, say, billing code or CPT code versus all of the bundle of fees that go into this. For example, we looked at DRG code for childbirth, but there may be other, when you go to the hospital to have a baby, there are a whole bunch of other things that get bundled into it. So you have to be very careful about comparing apples to apples. You have to look at place of service, like we talked about, an in-home place of service versus in the hospital. Or in an ambulance. There are different rates for all of these things. The other thing, and I can't tell based on the question here where the person maybe was looking at the data, but hospitals also publish this data. The data we looked at is payer data today. I feel the payer data is more useful, frankly. Um, we also work with hospital data and see a lot of hospital data. The payer data is updated more frequently, and I think the enforcement on payers, particularly nationwide carriers, is likely to be more stringent than a small rural hospital, for example. It's just sort of my opinion, and it's a bit of a numbers game with CMS. I figure it's much easier for them to go after United Healthcare than it is a small rural hospital in Idaho. Um, Hospitals also publish their shoppable rates, which is something different that we're not talking about today. We're talking about the price transparency data. So there's a whole bunch of things in here. I'll be the first to admit, like price transparency data, it's not perfect, but it is often directionally correct and useful for a lot of different things. But it is far from perfect. I don't think you can use price transparency data yet to be able to look at it and calculate what, Garth's bill is going to be when he decides to have another kid here from the hospital. So I think people are out there trying to do that. I think it's not there yet. Like I think there are too many other variables. There are other factors that they're not required to include in price transparency data. So it's a good question. And thank you for
I'll
that.
say one thing more about so there's a field in the data for a different kind of like a rate type basically. So usually when we do sort of something for a customer, um, we'll try to narrow it down to the ones that are actually relevant, that are actually really used. So like if there's something that is always billed on like a per diem basis, there's a flag in the data that says this is a per diem rate. So it's in there, so generally speaking, the rate data will let you sort of distinguish those different scenarios, as I understand the question. So it's in there, but you do have to be a bit careful about how you use it. So it's just another example of, like, yes, the data is out there, but you really want kind of like a partner, like a data partner to help you go through it and really pair it up with what really happens, so otherwise the outcomes, the numbers you're getting at the end will be sort of present in the data, but they won't really be the real numbers, if that makes sense. So
That's right. Like the person asking the question was asking about a colonoscopy, and you would want to make sure that you look at the place of service, right? Because we see garbage rates in there for, places where people don't get colonoscopies in an ambulance. And, so stuff like that has to be thrown out. You'll be in a hospital at usually outpatient or ambulatory surgical center, and those are what you want to, compare to. So it is important to be careful with that. Speaking of having a partner, let's see how our AI stuff is working and if it created a bunch of slop or if it actually worked. It actually looks pretty good. So this is something that's still in the works at Gigasheet and in sort of beta. We use it a lot, actually, increasingly internally. We do a lot of checking kind of behind it to make sure that it's working on the correct assumptions and things like that. The cool thing about this is we gave it that sheet. We could give it um, hundreds of millions of rows of data. We can give it multiple states, multiple markets, and huge questions to answer. It would just take more time. But you can see based on what I gave it, I said analyze this data for Idaho, drill into regions, visualize range of rates, and then I can see how it started looking at zip codes and which billing codes. So it knows, from its general knowledge how to do this. And then with the help of our AI, which is specialized for price transparency, it's able to generate this executive summary here, which looks pretty good. I think at first glance, obviously I would want to dig into this in a lot more detail before I make any decisions based on it. But, based on what I'm seeing in the data, I would expect this VA to be much lower here. So it thinks this is market share. Maybe that's true. That's the number of providers. I'm not sure we can say that's the payer's market share necessarily, but it's a decent assumption that if you have more providers in your network, that maybe you have a more dominant market. I asked it to drill into Regents and their rates for an office visit, and we can see there's definitely that variance in there that we saw. Um, and it's compared Regents to the average for the market. And then it's done something in poor contrast here saying, okay, yep, it's made some caveats, which makes sense. So pretty cool. That that I think I give it a solid B plus on that, especially considering it wrote this whole report in, I don't know, whatever, 15 minutes here in the last 15 minutes. So not bad at all. And that's sort of a preview of how we're using and looking at some of the AI capabilities with price transparency data.
yeah, we're going to continue to develop that. That's kind of like a sneak preview. But I think if you, depending on how excited you are about, a lot of hype about AI, maybe you care, maybe you don't. But I think um, what I think is a really exciting possibility with something like that is that you might have a question that you're pretty sure the data could answer for you, and maybe you don't want to go in and do the digging yourself. And traditionally, what you'd have to do in that case is maybe you go to a consultant or something, and it kind of takes a long time. Usually, it takes a while for you to get the answer back, and so you might think it's not really worth it. It's like 3 days for 4 days. I don't need a week later. I don't care. If I could get the answer today, I would care, but in a week, I don't care. So there's no point in having the consultant help me out. But with the sort of technology-oriented solution, like what Jason was demonstrating there with the Claude and the AI, that's something where you could imagine getting that answer quick, and it's a very digestible form. And so I'm sort of excited about that possibility where, you can have access to this data and there's some question on your mind, and you can really get a pretty rich, meaningful, sort of analytical answer out in a short turnaround time that really could be relevant for a business decision that you're trying to take.
Well, what I like about it is it's easy to go into the actual data that we were looking at and check it, right? Like it's not such a black box that I can't go verify if those numbers are right. Like I have the same data that it has, and I can go into Gigasheet and spot check like those fact check it basically and make sure that it is accurate. And then, as far as it's like assumptions or strategy and stuff like that, I'd probably take with a grain of salt. That's where you really do need people who have intimate knowledge of the market, like the many brokers and consultants have. But certainly on the data analysis part, it's super, super interesting and something we're going to keep working on. That's it. I don't see any more questions in the chat, and we're at just about 10 minutes to the hour. So we'll leave it there. If you do have questions or would like to talk more about this stuff, reach out anytime. I love talking about it. You can contact us at sales@gigasheet.com if you want some sample data for this use case or other use cases, or would like a demonstration. Let us know, and a member of our team will be happy to help. Thank you.